So the timeline for enrollment, we sent out letters, 5 different versions of letters to all 1.12 million people, telling them that you can choose a plan. You can, if you're already in Bayou Health, you can stay in your plan. You can get a new plan. You can, and then if you're not in Bayou Health, you need to get a plan for mental health and substance use treatment. We're giving you 60 days to choose. Here's all the different ways you can choose a plan. And if you have not chosen a plan by next Friday, November 6th, we're going to pick a plan for you. So everybody will be in a plan. Nobody's going to be left out. If we pick the plan, or if the member picks a plan, everybody has until the 26th day of February to change plans, effective the next month. Now, if you change after the 6th of November, that won't be effective until January. But whatever plan we assign you to the night of the 6th of November is the plan you're going to be in for December. We always, if we change plans, it's always effective the first day of the month. No one will ever change plans during the middle of the month. So if you have verified that someone is in Plan A on the 3rd day of December, they're going to be in that same plan for all dates of service at least through the 31st of December. The soonest they can change plans is going to be the first day of the next month. Now, during that 90-day transition period, there could be some movement of people between plans. If they get a letter and say, oops, that's not the one that I want to be in. I want to be in a different plan. They can call, they can change. It'll be effective the first day of either January or February. Now, after the 26th of February, we're going to what we call lock in people to the health plan that they're in on the 26th of February, and they can, in order to change plans, they'll need to be able to show just cause or good cause, that they have a valid reason to change. And we look at those on a case-by-case basis and make a decision. And the next opportunity for an open enrollment will be next year between September and November, when you can change for any reason. So this is important in terms of we're going to have those plans for December 1 locked down as of the 9th of November. Monday, the 9th of November, we're going to send the plans, their list, their roster. These are the folk that you will have for the month of December. And they're going to start sending out ID cards and welcome packets. Now, let me just say this, is the ID card, a person may have an ID card, but that's no guarantee that is their health plan. Is by June of 2012, we already had folks that had ID cards for all 5 health plans. So the best way to verify eligibility, if there's any doubt, is we've made a way that even if you're not enrolled with Molina as a provider, that you can sign up, and through their secure email web-based verification, you can verify the health plan that a person is in. However, it is only going to tell you the plan for the current month. So if you check it on, you can start signing up on November 15th, but if you check it on November 20th, it's going to show the November plan. It won't reflect the December plan before December 1. I just wanted to say that. Now, let's switch to providers. We also did some focus interviews with providers, some surveys, this was reinforced a lot of the things that we had heard and already knew. One is that some providers have negative feelings about any change in general, and this change in particular. And just uncertainty about what to expect. Providers say they have a history with Medicaid changes being difficult. I guess you can say our reputation precedes us. And then they feel uninformed given the implementation date of December 1 is fast approaching. And so this is a little quote. It's anonymous, so it may or may not have been one of you who said, "No one likes change. Change is always bad." So we would probably, if we took a vote, agree or disagree, I think we'd get a majority in agreement. There's no way to sugarcoat this or whitewash it, and I'm not going to try to. There will be an impact on providers when you transition from interacting with one payer for your Medicaid enrollees, Magellan, to interacting with six. 6 possible payers instead of 1, 6 different websites and provider portals, 6 different sets of forms, policies, provider handbooks, 6 different places to submit claims. So what do? How can we simplify? How can we make that easier? Each of the health plans has developed or is developing great, what I call work aids or cheat sheets that is a one-stop source. My goal, our goal, Dr. Dunham's goal is to keep providers from having to go on a scavenger hunt every day looking for information. And so we're working with the health plans to aggregate information and to make it easier for you to find things. Time is of the essence, again, 22 working days, counting the rest of today. So that is to get contracts executed, credentialing completed. And here's the thing I learned in 2012 with Bayou Health. You can have all the I's dotted and all the T's crossed on your contract, be credentialed, but cash flow is you have a separate process to enroll in electronic fund transfer. Well, you can be doing that as soon as you get finished, not going, oops, whenever it gets the middle of December, and here's a check cycle. Actually, we have an informational bulletin that is going to be on our website that I'm going to be referencing later. It's number 12-13. And it has for all 5 plans information on enrolling in electronic fund transfer. It tells you what day of the week. If you get a paper check, they cut the checks and where they mail the checks from. But that way you can calculate how many days it ought to take to get from, if it's from the Canadian border or if they're cutting them in Baton Rouge. That could affect mail time, right? If it's upstate New York or locally. So we've got all of that for you. All of this here, the presentation? Can you hold that question till I finish, and then we're going to have questions and answers and pass the mic around so everybody can hear, okay, including me. Then we have processes that we're putting in place to allow for the continuation of requests for authorizations to Magellan through 11/30. And we're announcing some changes on that to get some of that backlog that we're hearing about cleared out and get some of those expedited. And then another thing you can be doing is enrolling with Molina to identify the Bayou Health Plan that the person is enrolled in. We've got an informational bulletin that tells you exactly how to do that as well and how to read those responses. Relative to one of our requirements in the contract for the health plans is that they must have a robust network of providers, an adequate network of specialized behavioral health providers. We actually have put in the contract time and distance requirements. Just because they have a provider type somewhere in Louisiana, if it's 100 miles away, that might not be good enough. We've got time and distance requirements. All of our health plans have stated that they want to contract with the current Magellan contractors. If someone is no longer eligible to participate in Medicaid or Medicare, then our health plans cannot contract with them. And even if a provider is not contracted with Magellan currently, will be able to enroll. Now, they still have to meet licensing requirements, DHH licensing requirements, but the Office of Behavioral Health special credentialing requirements, those we have retired those in September. Each of the 5 health plans has credentialing requirements. They're all required by us to be NCQA recognized, so they will use those, the NCQA requirements for credentialing. Then this is very important to us, is we have in the contract a requirement that health plans cannot pay less than the Medicaid published fee schedule in effect on the date of service. We published the initial Bayou Health fee schedule for mental health and substance use treatment services on October 6th. It's on our website, makingmedicaidbetter.com. It's a 5-page document, and it will be kept current. That is the Medicaid fee schedule, the published fee schedule. So providers cannot pay less than that. We use the current Magellan rates to establish that fee schedule. All 5 health plans are required to cover all medically necessary services included in the Medicaid state plan. They have the option to provide extra benefits or alternative services that are not in the state plan, but they must, at a minimum, provide the services in the state plan. And they must use Louisiana Medicaid's definition of medical necessity that was published. It's an administrative rule and was published in the Louisiana Register. So we've got a single definition of medical necessity for all 5 Bayou health plans, for Magellan, and for fee-for-service Medicaid. And again, on the administrative end of things, we're committed to not just now, but continuously identifying ways that we can reduce administrative complexity for providers. One of the things we're working with the Office of Behavioral Health, Medicaid is working with the 5 health plans to develop common forms, like the assessment form, for example. We have arranged with Molina, even if you don't have a Medicaid provider ID number issued by Molina, as long as you have a National Provider ID number or NPI, and you are in network with one of the 5 health plans, you will be able to go on that Molina website and verify what health plan someone is in. One of the things that was expressed to us as being a concern, we know there are a lot of behavioral health services, specialized mental health, substance use treatment, outpatient, that is not covered by Medicare. Remember I've said we've got a lot of Medicare dual eligibles, bumping on 100,000 that are going to be moving into Bayou Health for any behavioral health not covered by Medicare. And so it would be quite cumbersome for providers, even if you know a service is not going to be paid by Medicare, to have to send that claim to Medicare first. We've got a list of all of the services that can bypass submission to Medicare and that you will be able to send straight to the Bayou Health Plan. They have their claim system configured to be able to go ahead and pay those even though the person has Medicare as their primary insurance. We've got an informational bulletin that has the exact codes and provider types that we're talking about with that. And then we have worked to develop a grace period during which any services that are authorized as of November 30th, the day before the contract begins, will continue to be honored by the receiving Bayou Health Plan for a length of time, and if necessary, is that units, whatever the monthly average of units would be added as well, so that a claim will not be denied during the grace period for no prior authorization or because the provider is not in network on the day of service during the grace period. And so that informational bulletin, very important reference for providers. The number is 15-18. It's being issued today. And we have arranged for all 5 health plans to start accepting requests for prior authorization for services that expire after December 1 on Monday, November 23rd. Now, for purposes of contract compliance, those are going to be date stamped December 1, but they will be able to get those and be able to hit the ground running first thing Tuesday morning, December 1st. And we've developed the informational bulletins, the work aids, the single go-to web address for all of the materials that I'm referencing is makingmedicaidbetter.com. If in the middle of that page, you will see helpful information. And we've got a link called Provider Call Resources. And if you bookmark that page, that'll be your go-to page. We update it regularly. If we've answered questions, those answers could even be updated. So we strongly encourage you to check it often. The closeout activity for Magellan, because Magellan will continue to arrange and pay for services through December 30th. For few inpatient and residential services, they will even have financial responsibility for a few days post December 1, and we'll show you that. So clinical or member appeals for services up through November 30th can be, member appeals can be filed by phone through the middle of December or by fax, email, or snail mail through the last day in February. Provider claim disputes or provider appeals for dates of service through November 30th they have 365 days from the provider has 365 days from the date of service, and then there's 180 days from the explanation of benefits, which means the line in the sand, the last day that any provider for any claim would conceivably be filing a provider appeal with Magellan for services on or before November 30th is May 31st, 2017. But that is all triggered by the date of service.